My name is Victor. I've been a doctor since 2004. Actually, I spent most of my training in Singapore General Hospital before Sing Health sent me to start a new team when the new Sengkang General Hospital opened. Yeah, so currently I'm the head of department. I've already been there for 4 years already. It has been an extremely fulfilling experience. And I also did my training in Stanford University, which was really a very big eye-opener. And I was very fortunate. I went there before the pandemic started. So I actually did all my traveling for the next few years already. Yeah. So jokes aside, I'm definitely looking forward to more traveling. I'll be talking about anxiety disorder. Let me try and share the screen. So anxiety disorders is something that is really common, and many of us have symptoms of it. I'll be talking a bit about the types of anxiety disorders, what are the risk factors, what are the clinical features, and how we treat anxiety disorder. So right now on the left, you see this diagram, right? Relax, coping, stress, anxiety, panic attack. I think I'm near panic attack now, seeing that so many people are locked on online. Yeah, so anxiety does have its function. It's not always a bad thing, because when we are anxious, we tend to perform slightly better. Of course, when I have a panic attack and I suddenly disappear from the screen, then you know I'm not doing so well. Now, so in order to help you understand what anxiety disorder, I thought I'd give you a few cases. The first case is that of a 46-year-old woman. She has been seeing me for poor sleep, headache. She's always worried about a lot of things. She's very worried that her son is going to NS, and she has seen many family doctors. So she's always very worried all the time, worried so much that she can't sleep. Also have a thing what she could be suffering from. Later we will come back to this case. Now in case 2, we have a teacher. He's a 30-year-old teacher. She has been having frequent chest pain. She has been having shortness of breath. She sweats, she feels her heart beating very fast. And she feels very anxious when these things occur. She reports moodiness, poor sleep, tiredness, not wanting to meet out with friends. And all this started after she had a recent promotion in school. So she went to see a heart doctor, and the heart doctor said that all her tests are normal. Then they referred her to see me. Also, this is case 2. So have a time to think, what do you think she is suffering from? Now, case 3, we have a 24-year-old man who sees me for feeling very anxious and self-conscious around people. So this anxiety that he experienced across every single setting, whether it's in school or when he's outside of school. And even when he was seeing me, he appeared very shy. He does not dare to speak up. He avoids social gatherings. He does not dare to date. He's actually very keen to meet people, but he's very worried that anxiety will show. People can tell that he's getting very anxious and he'll embarrass himself. So this is case number 3. Also, when we meet with certain things that strike fear in our heart, usually there's a flight or fight process, right? Yeah. So this is when the adrenaline in our blood start pumping. So sometimes we might decide to fight. Sometimes we might decide to fly away or flight. Yeah. So that's what anxiety is about. Now, at the start of the presentation, I did talk about anxiety disorders, right? And how anxiety actually can be helpful. So when we are not anxious at all, actually our performance is very poor. Or like when there's no stress at all. For instance, let's say I'm a student and I don't have exams. There are no grading, there are no tests. Then there is no motivation to study, right? Yeah, so my performance will be very poor. But if there is some stress from parents or some stress from teachers, there are tests and you need to meet a certain grade to move on to the next level, then your performance will go up. Now, the problem is when a lot of the people who come and see me, they experience too much stress or too much anxiety. And as a result, their work performance will drop. So there is a optimal place where we want to be right around the center. So too much stress or not stress at all is not good for us. So for many of my patients, I often tell them who are seeing me because they're very anxious or very stressed, sometimes I tell them that they have to trick themselves. They have to be a bit more easygoing. Don't be so hard on yourself. And actually, when you do that, your performance will go up. So today I'll be talking about these various conditions. Actually, there are a lot of anxiety disorders, but I don't think I want to share about every single one. For instance, specific phobia is something called simple phobia, just afraid of very specific things, afraid of cats or dogs or cockroaches, which is really very common. So I won't be going into all of this. No one has ever come and see me because they are afraid of cats or dogs before. But I'll focus more on the top 4 conditions, which is number 1, generalized anxiety disorder, panic disorder, agoraphobia, and social phobia. So how common are anxiety disorders? Actually, the Institute of Mental Health, they did a mental health survey on many people in Singapore, and they found that actually anxiety disorder is quite common. So most common is depression, and then you have alcohol use disorder, and then anxiety is among the top few conditions that we suffer from. So it is quite prevalent. Now, who gets anxiety disorders then? There are some risk factors. So mental health conditions are very different from other medical conditions, right? For instance, are different from some other medical conditions, right? For instance, if we catch the flu virus, we get flu. Yeah, so it's very straightforward, right? So it's a virus and then you get the condition. Now, for mental health condition, is pretty much like medical conditions like diabetes or high blood pressure. So usually it's a constellation of factors working together to result in the condition. So it's not a equals to B, but rather, it's A, B, C, D, all the way to Z, all combining together to result in the condition. So biologically, let's say someone have parents that are more anxious, then the chance that the children have anxiety disorder becomes higher. Actually, my mom is pretty anxious. So that's why I think as I get older and older, I'm also becoming more and more like her. And I'm becoming more and more anxious as well. So I kind of blame it partly on my genes. So the other things is sometimes there's a lack of enough neurotransmitter in our brain. So neurotransmitter are actually chemicals that the nerve cells in our brain use to communicate with each other. So when some of these are inadequate, we might develop things like depression, anxiety disorders. Now, you might ask me, so is there a blood test to do for this neurotransmitter? No, unfortunately, unless we poke a needle into our brain and extract the brain cells, which is fatal, of course. Therefore, no, we can't really do a blood test for anxiety disorders. But suffice to say, many of the medication that are used for anxiety disorders actually work directly on the brain cells through the increasing the neurotransmitter, and they do work wonderfully. Therefore, the hypothesis is that there is a lack of this neurotransmitter. Being women also increase the chances of having anxiety disorder. Women tends to be more anxious than men. There is a hypothesis, it's very evolutionary, because men, they, in the prehistoric time, you have to go out and do hunting. So if you are too anxious, you cannot face the big animals, right? You cannot face the lion, the cats, or the dinosaurs, right? But women, they have to stay at home and look after the children. If they are very calm all the time, they are not overly anxious, that's not good for the kids, right? So an anxious woman, housewife or mother will be more responsive towards the children's needs or towards the family needs. So evolutionary, there is this hypothesis that's why female are more anxious than men, which is also seen in some of the brain changes. People who have more challenges in childhood have a higher risk of anxiety disorders in adult life. And people who have more financial difficulties in their family also at higher risk of anxiety disorders. Then psychologically, we do find that certain personality, some people are just anxious by nature, even when they were children, even when they were young adults, they tend to be anxious by nature, or people who are very perfectionistic, they tend to develop higher chance of developing anxiety disorders as well. Yeah, so these are the risk factors. So these are the brain changes that we're talking about. There's a circuit in the brain that controls our fear. These are the amygdala, the hippocampus, the hypothalamus. Yeah, so there are brain changes when we develop an anxiety disorder. So science has really progressed a lot, right? I mean, about 100 years ago or 200 years ago, it's a lot about spiritual possession. 100 years ago, it's a lot about what happened to us in our childhood. And then in the past 20, 30 years, with brain imaging, with DNA testing, mental health conditions are starting to become more and more scientific, and we are able to pinpoint, even which part of the brain is involved. Like even in obsessive compulsive disorder like OCD, in certain parts of the world, they even consider surgery for treatment when every other treatment fails. So mental health condition is becoming really more and more scientific. It's not a woolly science anymore. Just now I was talking about the neurotransmitter, and there they are. So these are our brain cells. If we look at our brain under the microscope, it will look like that. It looks like octopus or spiders, And the way for one cell to communicate with each other is actually by releasing chemicals from one cell to another cell to communicate. Yeah. So therefore, when some of these chemicals are not balanced, like too much or too little, it can result in the brain cells having difficulties communicating with each other. And then as a result of our brain chemicals, we might manifest anxiety condition. Yeah, so this is not something that is so easily overcome by willpower, right? We can't really say, I want my neurotransmitter to go up or go down. Yeah, so sometimes some medication is helpful. There are other ways to increase this neurotransmitter, which I'll talk about later. So this is DNA. I'm sure all of you can recognize it. So yes, there are several genes that have been identified to increase our risk of anxiety disorders. So overall, when we are talking about anxiety disorders, we talk about the risk factors, we talk about the types of anxiety disorders. But overall, for me, when I see someone with anxiety disorder, regardless of which type of anxiety disorder there is, there's always an element of fear. And this fear is usually out of proportion to the actual risk. Meaning like cockroaches, right? Some of us are scared of cockroaches. I'm scared of cockroaches. But actually, does the cockroach bite us? I don't think it has bitten people before. We die, are they poisonous? Actually, they're not, right? But yet, when we see a cockroach, especially the ones that fly, it strikes a lot of fear in our heart. So when I kill cockroaches, I really have to carry an umbrella with me. It's very amusing, but in case it flies down, I'll open the umbrella to protect myself. But really, so what if it flies, and so what if it lands on our skin? It doesn't kill us. So this cockroach fear is really something that's very out of proportion. So with fear, there'll be avoidance. So in all these anxiety disorders, there are avoidance. So for instance, if I see a cockroach, I definitely would not go forward and hug it, right? Yeah. Similarly, if a person have a phobia of certain things, or anxiety disorders, they tend to avoid this situation. So avoidance is something that is critical to the diagnosis of anxiety disorders. And lastly, there must be impaired functioning. Impaired functioning means that this anxiety or this fear that the person experiencing has affected their daily lives. For instance, it has affected their ability to study, their ability to work, their ability to function as a parent. So there must be some kind of impairment. If there is no impairment, then it's not really something that we will call a disorder. So for instance, my fear of cockroach, it's not really a disorder, right? Because it doesn't really affect my daily living. I can still work, I can still function as a person. So there's really no need for me to see a psychiatrist or a psychologist, right? Yeah. So this element of impaired functioning must be there. Of course, if I'm afraid of other things like that is a daily, there's something that I'll see every day, then maybe I have to seek help already. Okay. So I actually see a Q&A question, but somehow I don't see my mouse. Let me just take a quick look at the Q&A question to see if it's something relevant or no, I can't do it. Okay, never mind. So how do we diagnose mental health condition? We're really looking based on a series of criteria. Again, there are no blood tests to diagnose a mental health condition. We can't base it on a brain scan either. It's not a stroke. The brain changes are very subtle. So what we use is we look at this diagnostic guide called DSM-5. There are various diagnostic guides worldwide. There are the British version, the American version. But basically, you need to satisfy a certain number of criteria before we say that the person suffers from a specific condition. So the first one is panic disorder. So what are panic disorder? So a panic disorder is actually recurrent panic attacks. And what are panic attacks? I think many of you must have watched it on TV and know what panic attacks are, right? So when a person experiences panic attack, they will hyperventilate, they breathe very fast. They breathe so fast that sometimes their hands become numb and they get cramps, they get chest pain. They feel like they are going to fall down. They may start shouting or screaming. They think they might be going crazy or they're going to die. So that's what a panic attack is like. It's something very intense fear. Now, panic attacks do not last throughout the day. So usually they're very discrete, episodic in nature, maybe just for about, sometimes as short as a few seconds or 1 minute or 10 minutes or 30 minutes. And I'm sure many of us must have experienced panic attacks before. So when these panic attack doesn't mean panic disorder. Panic disorder means there are many episodes of panic attack and the person becomes worried about the next attack. And as a result, they modify their behavior. For instance, some patients get panic attacks when they go to a certain place, like go to schools or go to crowded areas. So every time they go there, it can trigger a panic attack. Yeah. So as a result, they modify their behavior. They stop going to all these kind of places. They don't want to go to crowded places. Or have a patient, he gets a panic attack when he goes into an elevator, enclosed spaces. As a result, everywhere he goes, he has to take the stairs, which is quite painful. He probably cannot go to the Westin, the highest hotel in Singapore, right? Or MBS for high tea anymore. Yeah. So, and some people have panic attacks when they go onto a plane. And as a result, some of the patients who see me has not taken a plane ride for the past few years, which is not such a big problem today with the pandemic, I guess. Yeah, so that's panic disorder. Now, just now we talk about, I kind of talk about agoraphobia already. So agora actually means a marketplace. It's an old Greek word for marketplace, and phobia means fear, right? So agoraphobia means fear of the marketplace, and they are scared of going to public places, spaces, enclosed places, in crowds or outside of home alone, where they think that escape might be difficult, help not available. Yeah, they often come together with panic attacks, but not always the case. Not always the case. So I have a patient, she has trouble going out of the house alone. But when her children goes along with her, and her children are really quite small, she doesn't feel so fearful. So that's agoraphobia, fear of leaving the house, going to places that are very crowded. So a common question that I always ask my patient panic attack is, do you dare to go to Orchard or not? Do you dare to take the crowded MRT or not? Although Orchard is not so crowded these days, right? It's kind of fallen out of favor. Okay, so back to the first case scenario, we talk about the teacher with chest pain, shortness of breath, sweating, and palpitation, and she feels very anxious when it happens. She thinks she's having a heart attack, and the heart doctor say that it's normal. So this one is actually panic disorder, in case you haven't figured it out yet. Now, if someone presents to me, never seen any other doctor before, and they have this like hyperventilation, chest pain, I'm not going to say panic attack, if they've never seen any other doctor before, because it jolly well could be other medical conditions, right? Because other conditions can present with shortness of breath or chest pain as well, like a heart attack, or asthmatic attack, or sometimes even stroke. Yeah. So when they come to me with these symptoms, I will, of course, want to take a very detailed history, do a physical exam, do a neurological exam, and make sure there is no weakness. Listen to the heart and the lungs. And often, if I am not, and if I think there are risk factors, for instance, the patient has high blood pressure, high cholesterol, diabetes, I would be very cautious. I will not label it as a panic attack first, and I'll definitely refer them to see another medical doctor, for instance, a cardiologist or a lung specialist, just to make sure, something else is not wrong, or you don't want to be barking up the wrong tree. Of course, the ECG will be very helpful just to see the heart pattern. Nowadays, what's very good is the Apple Watch, right? Not that they're paying me for this talk, but it's really very good. When a person has a panic attack, if you look at the ECG on the Apple Watch, you can actually see the ECG pattern. So I thought that was quite a genius of Apple. Okay, how about social anxiety disorders? Now, social anxiety disorders are fear of social situation where they're exposed to possible scrutiny and they're worried of being negatively evaluated. It's very chim, but actually in a nutshell, it's like stage fright. So right now, if I will jumble up my words, right, especially during the start, you notice I was a bit like anxious. That's what we call stage fright or social anxiety disorder. Quite scary, right? There are like over 100 of you online. I cannot see any reaction at all. I don't know whether you are like rolling your eyes or what. So if I imagine you are rolling your eyes, or imagine you are like, he's talking nonsense, or he seems to be very scared. Then my anxiety level will go up. So that's a social anxiety disorder or stage fright. So a lot of the people who come and see me with social anxiety disorder, I got this guy who sees me. He's quite a high flyer, but the problem is he has difficulty presenting during meetings. So before meetings, he need to find all sorts of ways to calm himself, which is not very helpful, like taking alcohol or taking a sleeping pill first. So that's the social anxiety disorder. Or I've patients who are students. I have a patient in poly. She cannot do class presentation. Even going to lecture hall, she's very scared. She must be the first to get there. She enter lecture hall late. She feels that people are looking at her, they're scrutinizing her. She feel very anxious. So that's social anxiety disorder. So just now we talked about this case of this man, right, feeling very anxious, and he's anxious across all settings, whether when he was in school or what social situation. And even when he's consulting me, he appeared very shy. So this one is stage fright or social anxiety disorder. Quite easy, right, this one? Now let's move on to GAD or Generalized Anxiety Disorder. Really, a lot of people has it. I suspect my mom has it. I suspect I have it as well, where you worry excessively over very minor things. Like when it rains, you worry, oh, did my son carry umbrella? Or your spouse come home late? Oh, did he have a bad day at work? Did he skip dinner? And worry so much till the person cannot sleep, becomes very restless, gets angry easily, they feel tired, they have a lot of muscle tension, like headache, or they feel a lot of tension around the shoulders. Then this is what we call generalized anxiety disorder. So they know they worry too much, but they find it very hard to control, they find it very hard to stop, and they worry so much that they cannot sleep. So this is GAD. So GAD is really, really quite common. And the problem with people with GAD is when they come and see me, they're also very anxious about treatment. You ask them to take medicine, they are very worried about side effects. You ask them to go for therapy, they're very worried it doesn't work. So one time I have this patient, she came in and then she asked for help, and then I said, okay, let's try this medicine. Then she said, but I'm very scared of side effects. So she left my room. A few minutes later, she knocked on my door and then she said, can I see you again? I changed my mind. I think medicine is a good idea. I think I better follow your advice. So I prescribed the medicine to her. So she left the room, then she came back again, knocked on my door, came back again, said, I think better not. Now she kind of did this about 6 to 7 times until I actually locked my door, because she was so anxious that I can also feel my anxiety going up, right? Of course, that was when I was really junior. This was maybe way back in 2006 or 2007. Nowadays, I have a better way of managing them. But she really came in, came out, came back in again. I could never forget her. She actually said she's Chinese and she keep using the word 可是. So she opened the door and say 可是, and then she closed the door and then come back in and say 可是 again. So it just went on and on and on. So remember to talk about this 46-year-old woman with poor sleep, headache, tension, back pain. So that one always worried about a lot of things, worried about health, worried about her son going to NS. And then she keeps going to a lot of doctors seeking reassurance. Now that one is GAD or Generalized Anxiety Disorder. I've actually written an article on panic attack before. You can Google Dr. Victor Kwok, panic attack, and it actually tells you about this patient that I had who has agoraphobia and panic attack. It was so bad that she could not leave the house. After she graduated from poly, actually she got the panic attack after taking a roller coaster ride. And subsequently, she has trouble leaving the house. And she couldn't find a job because she couldn't go for interviews, right? So very interestingly, after she saw me just one time, and we talked about how to have some relaxation therapy, we talked about exposure therapy, and then I started on the medicine. By the second appointment, when she came back to see me, she found a job already. She was very surprised, that one session actually did her so much good that she could now leave the house. I'm sure a big part of it is credit to the medication as well. After taking the medication, she felt a lot calmer. So by second appointment, she found a job. And then I said, okay, that's great. I don't see you so often anymore. So next appointment, I saw her like 3 months, 6 months apart, and she has been maintaining very well since then. So you can Google my name and panic attack, and you can read on this article online. So what happens when patients come and see me? Usually when they come, before they enter the room to talk to me, I'll get them to fill up a series of forms. These are the forms that we use so as to, I think many people, when they come and see doctor, they always complain that they wait very long to see the doctor, right? I felt the same when I have to see doctors, always waiting. So we kind of came up with this form for them to fill out beforehand. This is just so that we can understand them better. Like whether, remember at the start, we talked about how anxiety disorder is a multifactorial condition, it's a constellation of conditions that lead to anxiety disorder. So we're going to ask about things like anybody at home has a history of anxiety disorder before, how would your friends describe you? How was your childhood like? How do you cope with stress? How are your current circumstances like? Are you undergoing anything that is particularly stressful or not? So we'll ask a series of questions to see what we can intervene subsequently. And then I will also use this skill called the GAD7. So this is really more for GAD. So if they score high, like they tick 3 for everything, even before they step into my room, I kind of know, okay, I'm dealing with someone who is really anxious. Yeah, I will give them a set of questions to answer. So based on what they answer, I have a sense of what they are really here for. So if they answer like 3 for always feeling very anxious, cannot stop worrying, they cannot relax, everything is 3, then you kind of know you're dealing with someone who's very anxious. So how is a session with a psychiatrist like? A lot of people imagine, when they come to my room, they'll be lying on the couch, I'm like Kentucky, the Colonel Sanders, right? No, it's not like that anymore, unfortunately. And really, some people come in and think they'll be spending about 1 or 2 hours talking to me. Unfortunately, there's some pressure. I try to see I'm quite popular actually. So one morning, sometimes I see up to 16, 17 patients in just a span of 3 to 4 hours. So I really cannot spend 2 hours talking to one patient. Yeah, so we try to be very comprehensive, but also quite quick. And I try to do everything within like for 30 to 40 minutes. And then they can come back again and can reassess further. So that's actually how a consultation is like, or it's like any other consultation room. I also have a stethoscope. So sometimes my patient, they come in, they say they have cough, right? So I also listen to their lungs and I'll prescribe them medication, including antibiotics if necessary. Yeah, so they'll come in and then I'll spend time to talk to them to find out more about their condition. So a really detailed interview, a really, really very detailed interview. Sometimes it takes about 60 minutes. Yeah, but where I'm working right now, I have to be a bit faster than that. So the lady on the right is telling me about her symptoms now. She's not a patient. If you attended my previous talk before, I keep using her as a model. She's actually a doctor as well. She's a psychiatrist as well. Her name is Dr. Xiao. Yeah, so she was very spontaneous. I kind of just asked her, hey, can you take a photo? And then she just, within 30 minutes, she got all the photos for me already. Yeah, she's always very camera ready. So we talk about how mental health condition, like any other medical condition, is multifactorial, right? So there are biological causes, there are individual psychological causes, and there are social causes as well. Therefore, treatment in mental health condition is also, we also approach it through all these various methods. So it's not enough to just say give medicine. Yeah, you also have to talk to the person. You also have to administer therapy. And sometimes you got to intervene directly in the social circumstances. For instance, I've army boys coming to me and they're facing a lot of bullying at work. So you cannot say, try your best to handle the bullying. All right, goodbye. Sometimes I have to call the army officer up and talk to them and find out what's happening, right? And see how they can support the army boy in the national service. Or I have teachers coming to me, they are having a lot of trouble with their health department. I cannot just say, take the medicine, everything will be fine. That's not going to be the case, right? Sometimes I have to intervene directly. I have to give MC. I have to support them with letters. I probably will not be able to talk to the employer in this case because it's against the law, right? It's PDPA. But definitely we will offer some more practical help. Or someone sees me for anxiety disorders and they have the anxiety disorder was sparked off by the husband extramarital affair, right? Then again, it's not enough to just do individual counseling or just to give medicine, right? Sometimes you have to, as a doctor, you have to, maybe talk to the husband, or you may have to refer them to a marriage counselor, or you have to do the marital counseling yourself. Yeah, so it's very holistic. Or I have patients where the parents have Alzheimer's condition, then you got to get people in to help the father or the mother, right? Maybe get a recommendation to nursing home, etc. So really, my job really goes beyond the room. Is a lot of times also offering very practical help to my patients as well. So we are talking about medicine, and medicine do play a very important role in the treatment of anxiety disorder. The one that we use are antidepressants. Now, antidepressants are not just for depression, they're also good for other conditions like anxiety disorders as well. So they will help reduce the level of anxiety, they help reduce the ruminations. And patients often feel a lot calmer after taking antidepressants. We also give something called benzodiazepine, or these are really tranquilizers. Benzodiazepines are the infamous sleeping pills. Now, benzodiazepines, because they are sleeping pills, they're actually addictive. Now, antidepressants are not addictive. You know, if you take them regularly, after 3 to 4 weeks, the anxiety will get better. When you don't take them, you will not get withdrawal. Like, it's not like opium or alcohol or cigarettes, right? You won't. A lot of my patients tell me, oh, I don't want to be addicted to antidepressants. Yeah, sorry, you cannot get addicted to antidepressant even if you want to. You're not going to, if you don't forget your medicine, you're not going to hunt it down, you know, it's not opium or heroin. But sleeping pills, yes, sleeping pills are addictive. Now, so sleeping pills have to be given very cautiously. Usually, I don't give my patient anything more than 10 tablets at one time. Because if they take it regularly, they take it every day, after 21 days, they can get addicted. Addicted means when they don't take the sleeping pill, they can get withdrawal. Like how when you watch TV, those opium withdrawal, right? They might yawn, they might have runny nose, they might get, very uncomfortable. Some of them even develop seizure. Sleeping pills, my patients love it a lot, especially for anxiety disorder. They take it, they feel calm immediately, within minutes, and they feel very calm for several hours. So for someone with anxiety disorder, is fantastic. It's almost like drinking a glass of wine or 2 glasses of wine. But the problem is it is very addictive. Yeah. So this one is really just to buy me some time for the patient, or only for very extraordinary circumstances. For instance, my patient who has phobia of taking a plane. So maybe just take that sleeping pill before they go onto the plane, and then sleep through the whole journey, right? And even if they are awake, they feel a lot calmer. So really very periodic use, right? I mean, you don't take, unless you take plane every day, but most of us are not going to be doing that, right? You only take plane maybe once every few months, or once a year, or once every 2 years. So maybe that patient just need that one tablet of sleeping pill each time he needs to board the plane. Yeah, otherwise we try to stay clear of that, no? So the one in red is the one that I stay clear of. The one that is very helpful is the first category. Yeah, these are some of the medicine that we use. So we'll go through them. We'll show them what medicine it is. We'll explain what are the common side effects. The good news is most of my patients don't experience any side effects with the medicine. Again, some people do, some people don't. So it's really a matter of luck. And there are many medicine that we can use now. There are like more than 20, 30 antidepressants. So sometimes we do have to try a few types before we find the one that the patient likes. Like as in it works well and has very little side effects. So what do I tell my patient about antidepressant? This pamphlet we came up with. It helps to increase the neurotransmitter. It's good for anxiety disorder, depression. If you take it regularly, after 2 to 4 weeks, it will work. Yeah, it's not a drug. You don't take it today and then tomorrow you want to go dancing. It doesn't work like that. So you really have to be very consistent with the medicine. No, you cannot be addicted to it. Yeah, it's not alcohol, cigarettes. You cannot get addicted to antidepressant. And once they get better, they have to continue taking it for about 6 months to 1 year. Now, a lot of my patients will tell me, wow, 6 months to 1 year, that's very long, doctor. So I tell them, actually, it's not very long, right? I mean, I always give this tongue-in-cheek example of SK2. The SK2, if you buy, it's like $100 per bottle, right? You got to apply on your face. The SK2 is the Pitera, right? Don't even know whether it works, but you have to apply on your face forever. So apparently some of my female friends tell me, once you stop using SK2, your wrinkles will show very fast. So yeah, so if you compare this to SK2 is lifelong. This is only for 6 months. I don't think it's that bad. Yeah, or a real life example could be diabetes medication or high blood pressure medication, right? Or even acne medication. I remember when I had acne as a teenager, I took my medicine for several years. The doctor told me to stop. I don't want to stop. Yeah, so really 6 months for antidepressant is not very long. Now, what are the side effects of antidepressant? The bad news is that when you take antidepressant for anxiety disorders, it usually gets a bit worse before it gets better. Yeah, so during the first 1 week, they usually feel even more anxious. So we tend to start the antidepressant on a very kacang putih kind of dose, half of what we will give for depression. And then we slowly increase it so that they don't feel so anxious in the first week. They can also affect sleep. So some people may sleep more, some people may sleep less. So it's not definite. And a lot of my patients don't like it because they can also lower sex drive. So the libido will go down. Many of my patients come in and they are very clear, they don't want to take medicine. Then we will definitely consider therapy. Yeah, therapy is something that's definitely very helpful for anxiety disorders. This is a sleep hygiene pamphlet. So a lot of my patients with anxiety, like GAD, sometimes they cannot sleep. We also give some sleep hygiene advice. Sleep hygiene is like hand hygiene. What you need to do in order to sleep better at night. So sometimes we will tell them to, or often we tell them to not take alcohol because it can increase the number of awakenings at night and it's very addictive. don't drink coffee or tea after 12 noon. You may not know, but coffee and tea can actually last in our blood for like almost up to 12 hours. So if you take it after 12 noon, then you may have trouble sleeping at 10 p.m., right? Exercise is very important. Yeah, when people who exercise regularly, like do HIIT at home, watching YouTube, or they go for a jog, or they go swimming or cycling, they can often sleep a lot better at night. Yeah, we tell them to put their watch, their clock, and their phone away. Don't keep looking at it. You only serve to drive on the anxiety, right? They try to not nap. Yeah, napping is also not very good. If you sleep in the afternoon, it gets harder to sleep at night. Now, this you can actually refer to my previous talk. I have another talk with Brahm Centre on insomnia, and you can refer to it. You can Google my name, and help my viewership go up. Right. Hopefully, one day I'll be able to beat Gangnam Style. Right. It's currently at 200, so just way more before I hit 200 billion. Yeah. Okay, so therapy is something that is going to be very helpful as well. We talk about medication, we talk about offering practical help, and the last thing is therapy. Now, therapy is, again, not something just, talking about whatever comes to your mind. Now, that is one kind of therapy, but it's not something that is so popular these days. So therapy is something that's really very practical. It can be just educating my patient, telling them that you will not die from a panic attack. Yeah, so that's the kind of education. We call psychoeducation kind of therapy. We might teach them relaxation techniques like progressive muscle relaxation or deep breathing exercises. All this works very well. Another kind of therapy that is very important for anxiety disorder is actually exposure therapy. Now, exposure therapy means you get the patient to be exposed to the things that cause them to have a lot of anxiety and keep doing it until they don't feel scared anymore. Because we can habituate to our fears. For instance, I talk about being scared about cockroaches, right? So actually, one way to overcome my fear of cockroach is not to lie on the couch and talk about whatever comes to my mind, right? That's not going to help me get rid of my fear of cockroaches. Yeah, neither talking about cockroaches will not also get rid of my fear. So really, you have to do something very practical. And the way to really overcome my fear of cockroaches is really to go and expose myself to cockroaches. For instance, at the start, it could be looking at the cockroach, right? Walking towards it, to the point where I have to touch it, play with it, or even, some people keep cockroaches as pets, right? Some American cockroaches, they are kept as pets. So maybe I have to keep them as pets. Yeah, so I have to keep doing that until I don't feel scared. Yeah. So of course, I don't want to do that, right? To do exposure therapy takes a lot of motivation, and a lot of patients are not going to do it, obviously. Yeah. So for instance, the case of agoraphobia, where they are afraid of crowded places, then we work with the patient to come up with a series of things that kind of cause them to be scared in a hierarchy. So we'll ask the patient to come up with what's the least scary for you going to crowded places. So she might say, oh, going downstairs is the least scary to me. So I might ask, what's a bit more scary than that? Then she might say, oh, going to NTUC when there is not many people around is second most, is a bit harder, but still not the most scary. Then she might say, oh, going to NTUC during crowded hours with my husband is even scarier than that. And then, so we get them to walk up a hierarchy, go from least scary to most scary. And then they got to do it every day or several times a week. So this is exposure therapy. This takes a lot of motivation on my patient side. So when I tell them, oh, you go NTUC, you go downstairs, very often they say, oh, no, I don't want to do it. Yeah, then therapy will not be helpful. Another one is cognitive therapy. Now, cognitive therapy is a kind of therapy where we get them to identify their fears and unhelpful thoughts about fears and kind of challenge these thoughts to come up with more adaptive way of thinking. Yeah. So for instance, they might say, oh, my husband come home late. He must have had a bad day at work. He must have skipped dinner. Now, that's a very unhelpful thought, right? And when you think like that, obviously, you're going to feel sad, you're going to feel anxious, you're going to feel worried. So we get them to record their thoughts, and then we get them to come up with a more constructive way of thinking. For instance, they might come up with an alternative explanation why he came home late. Maybe he went to the gym first, or maybe there was a traffic jam, right? It's not always a bad day at work. So after that, so cognitive therapy is a lot about challenging all these unhelpful thoughts and behavior. Yeah. The last one, there are many kinds of therapy. There are 30, 40 kinds of therapy, and I really will not be able to go through every single one of them. Neither am I trained every one of them. The new one that is really a lot more interesting is something called acceptance and commitment therapy. This one is a bit different from cognitive therapy. In ACT, we just kind of get them to accept that, some of this anxiety will be there. We tell them not to fight the anxious feelings. Just let it come, because it really will just go away after a while. Yeah, so ACT is really a very different philosophy from older forms of therapy. And I find it really helpful for my patients. So ACT has its basis in mindfulness. Since Brahm Centre invited me to give this talk, I thought I should talk a bit about a mindfulness anxiety disorder. Really, anxiety is part of life, right? Like I mentioned, even I right now am feeling anxious. Really, it's like the weather, like today I wanted to bring my family out, but it was raining really hard. As a result, we couldn't go out today. Yeah, and we bought something from the coffee shop downstairs, which was fine as well, right? I had a really good meal. Yeah, so anxiety is like the weather. Sometimes we get anxious, sometimes we don't get anxious. Yeah, and that's fine. We are not always going to be calm, just like we are not always going to be happy, right? Life is never about being happy all the time. Sometimes we feel sad, sometimes we feel scared, sometimes we feel happy. Sometimes we don't feel much. So that's part of life. Yeah, the default mode is not we're happy all the time. So we do have to get our patients to accept that even with treatment, even with medicine, even with therapy, we're not aiming for a cloudless sky, a bright sky every day. Yeah. It's really, even if you're anxious, actually, there's a lot of things we can do. Even right now, I'm feeling anxious. I can give a talk, and I think I've been talking for quite long, right? For 43 minutes already. That didn't stop me, right? I'm moving my hands right now, even though I'm anxious. So in ACT, is really a lot about mindfulness as well, really about being able to accept that we are anxious. It doesn't have to stop us from doing what we like. We just have to roll with it. Yeah. So I think acceptance, being open-minded, a lot of these values in mindfulness are really helpful for people who are anxious. The last thing I want to share is patients come to me and say, oh, you talk about therapy, you talk about medicine, you help me write letters, you give me MC, you give me medical report. What can I do for myself? Now, there's a lot of things patients can do for ourselves, a lot of things I can do for myself, right? Things like exercising. Regular exercise is very helpful. Like try to aim for about 100 minutes a week. You can do 100 minutes all at one shot, or you can split it up over various times in a week. So exercise, like going to the gym, brisk walking, just changing to t-shirt and shorts, going downstairs, going for a walk, does wonders for our physical health, for our mental health. Learn to relax, do things that you like, your leisure activities, be it mindfulness practice, or you like to play a computer game, you like to play badminton, whatever you like, do spend time for yourself, be kind to yourself, do things that you enjoy so that you can relax. You like shopping, go ahead, right? Yeah, don't feel bad. Or, of course, don't overspend. Avoid coffee. Coffee, tea, Red Bull, they all contain stimulants that can make us more anxious. So if you're anxious, then don't drink more than 1 cup of coffee a day. Keep it to the morning. Don't take alcohol if you can. Studies have shown anything more than half a glass of red wine is harmful, increase the risk of cancer, or especially for the women audience, can increase breast cancer very significantly. So do avoid alcohol, and don't take your medicine with alcohol. Sometimes they will interact, and there will be more side effects. Now, the last thing you can do to help yourself is to have a good support network. Have people that talk to people who care, who love you. They don't have to be a therapist. Spend time with people who care and who understand you. Talk to them. You don't need many. 1 or 2 is good enough. Also, having a good support network is essential for our mental well-being as well. Yeah. So with that, thank you very much.